morning, everyone, and welcome to the webinar on why the Certified Digital Health Professional course is the best course. Everything is getting digitalized, and digitalization of healthcare is the next big thing in the healthcare industry. How far can doctors and healthcare professionals remain untouched with technology? Given the push by the government on digital health, we need a structured approach to enhance the usage of digital health tools and solutions. The Certified Digital Health Professional course, jointly offered by the Indian Institute of Management, Raipur, and the Digital Health Academy, will equip you with the knowledge and skills in the digital health domain. Today, we have with us Dr. Rajendra Pratap Gupta, founder, Digital Health Academy and Program Chair of the Certified Digital Health Professional course, Ms. Mevish Vaishnav, Course Director of the Certified Digital Health Professional course, Dr. Jagyasu Gaur, Assistant Professor, Indian Institute of Management, Raipur, Ms. Snigdha Samantre, Head Specialty of Mental Wellness, MPhil, Dr. Shalini Agarwal, Professor, Department of Radio Diagnosis, Pandit Bhagwat Dayal Sharma, Postgraduate Institute of Medical Sciences, Rohtak, and Dr. Sandeep Sivakumar, Assistant Professor, Indian Institute of Management, Raipur. So I would now request Dr. Rajendra Pratap Gupta to give a brief introduction of the course.
Thank you, Ashima, and it's a pleasure. The whole idea of this discussion and webinar is to let people know the vision behind this, what I went into building this course. We are actually doing this live on LinkedIn also, so people can ask questions there and someone will send it to us to answer. What I'm going to do now is to walk you through a presentation of this course. So in 2019, I founded the Digital Health Academy. And a year before that, serving on the board of the International Society of Telemedicine and e-Health, I had found the working group on capacity building. And clearly, I could see that digital health will invade every aspect of healthcare delivery, but we didn't have the human capacity to leverage the full potential. I think COVID has fast-tracked many things. All of us have used it. Though not of us don't even know what we do is digital health, but yes, we all have used digital health. So this academy came in 2019 and it was a good journey, but certainly this is a field where expertise is limited to few global authorities who have actually been the pioneers. And I had a fair chance to work with most of them. So what we did initially is we did a need gap assessment. So top people from the government in India, Asia Pacific, people in the US, Europe, UK, we got on calls with them. We did 1.5 hours, 2 hours calls with them discussing healthcare, the development of technologies, issues of privacy and security, emerging fields like gaming, artificial intelligence, 3D printing. So we went from tertiary care institutions like AIMS to King's College to the head of the World Health Organization, name it, and we spoke with them, top people in the pharmaceutical industry. Our goal was to make sure that we don't create a course because I believe in something, because I have an opinion on digital health. So you look at these names, I mean, they come from across the healthcare continuum, and most of them are at the top in their field. So I would actually thank these people and many. We did discuss with people, who were at the helm of their global organizations across sectors, who were innovating using technology. And it has taken us, I must say, a good 3 years, when you look at designing a course like this. Then the whole idea came is, I know we talk to people. So what was the whole idea of a structured course? So today, this is a fact that if you are not in digital health, you shouldn't talk about health. That's the truth. In fact, a lot of you who are listening this, who are into healthcare or providing services to healthcare, actually are doing digital health. And they need to understand it. See, like you can't, I would say, fly a plane without learning it. You cannot do health without learning digital health. That's the truth today. It is very hard to fathom this, but that's where it is. But structured course means that you would understand digital health from a complete perspective and not just a small video or article, because that doesn't give you a perspective. So, and this is my favorite thing, being into it. for a long time that even digitization, if I said that use digitization in health, it would be incomplete. There are clearly three different terms: digitization, digitalization, and digital transformation. And even this is not known to most people who write experts in digital health or start sharing without knowing what it entails to be that. Those who have been a part of the course, we are very happy and lucky to have people like Dr. Shalini, very senior professional clinician and administrator, and Snigdha, who's joined us today, and our management colleagues and the course people who are involved in developing the course, and Mavish, who is the course director. That it has taken us a lot of efforts to get people to understand in a very simple manner what these three words would mean for healthcare. And then DTX, when I spoke with pharmaceutical industry CEOs, 1 out of 4 didn't only knew about DTX. They had heard about it. 3 out of 4 didn't know about it. Whereas in the pharma industry, if you do not know digital therapeutics, certainly you do not know how you are going to engage with your chronic customer, chronic patient. You do not know that just selling pills won't take you far. You will get disrupted. Like Tesla came in 2003, their valuation is much more than all car companies combined, which have been into existence over 150 years. So pharma industry is also going to have its moment of truth, and it's already having it now. So DTX, a lot of people do not know, but everyone who is into pharma should understand digital therapeutics. Anyone who deals with chronic patients as a doctor should understand digital therapeutics. How would you know it? You cannot know by writing article. You need to learn it from the person who actually developed. So we got Dr. Anand here, the father of digital therapeutics, to take the course on digital therapeutics for the participants of this course. Then AI. It seems like only big guys are talking about it, but all of us are using it. While you are attending Zoom algorithms are running. While we are webcasting on LinkedIn is running the artificial intelligence algorithm to make sure it goes to people who are interested in these fields and will be sending them alerts. This is live. AI is a part of our living. So it's in healthcare. I mean, I don't think that, you will be in healthcare without using AI, and you need to use it consciously. If you know how to use AI, you can make the most out of it. And that's why the structured course is covering that. Then it's application oriented, so everything we teach or talk here about is done by people who have been involved in it, who have driven it, who are pioneers. So they talk about applications of all this, just not the theoretical or technology part. And this is the first course in the world that makes sure that we do justice to the professionals who join this. So there is healthcare, there is technology, and there is management. India's National Institute of Importance, IIM, with the best of professors, we have brought in those management concepts that you should learn as a healthcare or health tech professional to make the best use out of it. Because if you know only health and technology and don't know management, trust me, there's no point of learning these two. Management is very integral to what you learn in health and tech. And this is what we have done through this structured course. It has 3 levels: basic, advanced, and professional, which means basic is the theoretical aspects, advanced is the technological aspect, and professional is the application aspects. So a structured course could only do this. And this is what we have tried to do it. And I would say successfully, because our first batch is running and we have fantastic reviews. In fact, I get more worried with those reviews that go 97 to 100% of rating, because that means a lot of trust and expectation has been built in whatever we have taught so far, which means we need to keep up that level and probably improve it. That's what gives me satisfaction that we are delivering what we envisioned. It's been hard, but I think we are successful. And we'll continue to raise the bar every time we take a lecture or we share a live session with a leader. So we talked to a lot of people, during our first batch discussions. What came out was this, that primarily when people look at a course like this, first thing is you want to gain knowledge. What is digital health? I do not know. Then second is challenge yourself. So I always keep telling my course participants who are senior leaders is that there is a view about digital health when you hear a lecture from Dr. Joe Quader, the man who coined the term connected health. There is a view of the digital health ecosystem that I believe is true. But what those who are doing the course will do is come out with a view that will be much more comprehensive. So as an evolving field, those who are taking the course are not students. They are the leaders, they are the thought leaders, they are the doers who will actually take this field to where it really deserves to be. So it has all the components of nuances of implementation, how to get people to be more tech savvy, how to understand the network of the players in digital health and the network of digital health. I mean, we had instances where doctors were more keen. In fact, our first batch is dominated by doctors. Yes, 85% of them, fairly senior. And most of the people told us we want to be the first ones to do it. This is the approach if doctors or the industry leaders have. I can safely tell you that these are the passionate souls who are committed to improvement of healthcare. So when they see that the holy grail is digital health, and they say we want the first ones to be do it, you be rest assured that these are the people who will transform healthcare because they are looking at the cutting edge. They are looking at expanding the horizon. And this is the course that looks at getting it done. Some of the people would want to transition to admin roles. And this is where an opportunity through the course comes in. Improve the future prospects. I think everyone who does will understand that today you look up LinkedIn, you look at any postings of any hospital, pharma company, medtech company, everyone is looking and saying, do you know digital health? I have over the last 5 years not taken anyone in my team who doesn't understand digital health. Because I mean, if you do not know the backbone of healthcare, what will you do? So it definitely is about across the value chain, which is primary care, secondary care, tertiary care, and moreover, finding solutions to problems using tech. There are newer therapy areas coming where technology is becoming a therapy. Our course delves in detail on that. Improve the experience quality of life, identification of digital tools if you are into healthcare, and digital health in everyday life. And at the end of it, that's the message, digital transformation. Whether you're a clinician, how do you transform your practice? Or if you're into an organization, how do you digitally transform your organization? There is no way you will be able to do. There are some of the things that you see on the side on your extreme right. Artificial intelligence is something that you cannot stay away with, even for a week. We are already using it, not knowing it, so better know it in detail. Using data meaningfully, very important. I think when you look at our lecture on data visualization, how do you analyze data, how do you use it meaningfully, you'll be shocked at the opportunities you missed so far. Mobile apps, that these are actually what you call what we used to say the life skills. Mobile apps are life skills for doctors. Software as a medical device, digital therapeutics, cybersecurity, patient safety, and product development. Some of you would end up becoming entrepreneurs. What is the product life cycle in digital health? This class is taken by Abhirup Gandhi. He used to lead Google Life Sciences Verily as the Global Chief Trust and Compliance Officer. We want to make sure that those doing the course are not only looking at enhancing their clinical effectiveness or organizational efficiency, but also should they want to be entrepreneurs, what's the product development life cycle in digital? So this is what we intend to cover. Whether you are setting up an online clinic, setting up a new hospital, bringing patients to hospital, helping healthcare providers improving healthcare, or support clients in digitalization. The course format is a flexibility of recorded lectures. We understood that people are working, they are doing a job. It is very difficult to go and attend an on-campus program. So there's a flexibility of recorded lectures. There are webinars with faculty, live experts. We'll show you kind of experts we have for live sessions. There's a quiz. When you complete a chapter of course material, you get a quiz. You do the quiz, move to the next section. Pass marks are 50. We don't want to make it like a cakewalk because we really want to impart knowledge. We want people to look at it, understand it, but also don't want to make it really very loaded. Like, you need to get just 80% marks, because broadly, if you understood this field, then you will do wonders in what you're doing. Dissertation internship. So we'll walk you through what are the kind of projects our team members are doing as participants. There is a contact program we will have at IIM Raipur for 3 days. where people will get to interact, learn through immersive workshops. And it's always open. We have a WhatsApp group. People are always accessible. Like we are doing webinars to make sure that you have an informed decision on what course you take. Same way, when you are a part of the program, you have a complete access to the faculty, to the people behind the course. We listen, we act, and that's how we have become a course which finds a very high acceptance level among the participants. The first cohort includes doctors, medtech professionals, digital health professionals, allied healthcare professionals, pharma professionals, senior industry leaders, and academia. So it's a very diverse, complete healthcare representation in this first cohort. Well, the journey has been, as I said, now 3 years, 60 plus global leaders partnering with pioneers and industries. So one of the big difference of this course is this is not a theoretical course. Any of the people who take your lectures or talk to you are the people who have done digital health at scale. That's our criteria. So we are very careful to select our faculty. They have to be the world's best. That is what sets us as very different as a course. So as you can see, the best part of what we are is that faculty comes from the world's top organizations. I think something like which is a dream for most, I think for our participants, it's a reality. That at the end of it, someone will ask you, okay, you've done a digital health course from Digital Health Academy and IIM Raipur. So who taught you this? Most of the people would ask, and that's one of the things that I would want everyone to remember. Who taught you is the question that we'll get. And the answer to that will convince anyone that you are the best trained professional in this field. So we have made sure that it is not. So the first man you see who started the course lecture is Anish Chopra, the first chief technology officer of the United States and the assistant to US, the man who put health tech on the map of the United States. Bakul Patel, who led US FDA for 13 years in digital health, world's top person in this field, now had a Google strategy and on the board of Digital Health Associates, and also the one who has a very big influence on the course and the way we look at technology. Alain Labrie, the man who runs the world's tech system as the director of digital health as the World Health Organization and innovation. Sir Muir Gray, who started Cochrane and screenings in NHS. Yungkup, who set up telemedicine in WHO. Lord Nigel Chris, who was the CEO of NHS and member House of Lords. Sean Blaske, head of UNICEF Center of Digital Health. Abhiroop. So you look at the people, I mean, name from India also we have the best, I mean, who do at scale. Dr. Devi Shetty, is Dr. Sanjeev Prasher, who looks at management at IIM Raipur. So anyone who's on top in the field is our faculty. Graham Grieve is like the man. If you look at standards in health, so you'll talk of FAIR standard. If you Google up, he's the founder of FAIR standard. He's the one who takes the course on standards. So the best part of the course is, and this has been my vision, is that if I'm really looking at you all to be the best leaders in the world, how will I have you as the world's best leader if I don't get the world's top people today to teach you? So what I have ensured working with my team is to get you the world's best people to learn from. This will ensure that you end up becoming them, the leaders of this digital transformation journey. So why did we look at partnering together? World's two best institutions, management and digital health coming together. Executive alumni status means gives you an exclusive access to the network of IIM alumni. And then you also become certified digital health professionals and gets listed on the directory. Our vision is that we'll create leaders who will transform healthcare through digital health, and we will not leave any stone unturned to give you what is needed to become one. So we are very happy that first cohort will produce 47 leaders, and they, I promise, will be among the world's top. This is what we have got as people's trust in what we are doing. 97% rated the course content as excellent. 96.43% rated the course for the value of investment as excellent and good. And 100% rated the faculty as excellent and good. Well, this is something that any course in any field would have an aspirational dream for. But this was our basic criteria. Good was never a goal for us. It was being the best. It was being excellent. Good was never our target. I would never have look at good as a rating for what we do and the kind of leaders we create. Even the leaders who come out would be rated as excellent, not just good enough. That's not what we want. That is what we want to do through the courses, to create the world's best leaders, among the greatest leaders in digital health. And I'm sure that, as you see the work coming out of our first cohort and subsequently the others, we would be the ones who would create the leaders of the future. So live interactions, I want to really share this. So live interactions are about meeting those people who did transform, who pioneered, and asking them questions directly. Very rare opportunity you would get, like Dr. Jay Sanders, who actually started television medicine, who used AI 56 years back. Dr. R.S. Sharma, who created CoWIN app, who created Aadhaar, the world's biggest identification number. And Sabin Dima, who is the first one in the world to merge blockchain and AI, and is creating AI verse. He's literally the Sam Altman of AI and blockchain together. And I think over the next few weeks, people will interact with the one who played a key role in founding robotics. He will teach robotics. Someone who led the world's biggest telemedicine platform. So live interactions are not about meeting ordinary people. None of our faculty is ordinary. They are all extraordinary. To interact with them live is a rare opportunity for anyone. And this is what we want to provide for us. Live interaction was more about getting to meet those leaders. Most of our participants had the opportunity to meet Bakul Patel in person in Mumbai, our other faculty too. And that is something we'll continue, that our annual forum, people will meet them face to face as well, not just online. Right now, we are working with our participants of the first cohort on 8 projects. So while they learn, they have understood this domain, it is time for them to translate that into working papers, knowledge papers, so that the industry or the government could pick them up and start implementing. So right now they're working on the Ayushman Bharat Digital Mission, Ideas for Action, digital health best practices from Canada, Estonia, USA, UK, and India, digital therapeutics, boosting adoption among doctors, among hospitals, pharma industry, then medtech sector, and then artificial intelligence. So these are projects that people will be working on, those who are doing the course. And finally, these are the things that will set them as leaders, because their names would get into these projects as the authors. One of the things we create is get them the visibility and the ability to influence the system. So all those who are a part of this 8 project would be the co-authors of these projects. Just imagine these papers going across the world. While you're doing a course, you have already become an author of the thought leadership process in the healthcare sector. That's our vision for this course. I mean, for us, I never call them students. They are participants. They are the leaders. And the whole idea is that leadership gets, by the time you finish this 1-year course, you've already become that. That's how we work with people. This is the meet and greet, where when we host the annual forum, people get to meet our faculty, the participants get to meet each other. And I think this will grow with time. There is nothing that can replace the human dynamics of face-to-face meeting, personal interactions. And with time passing, we will keep increasing the frequency. We'll find opportunities to make people meet from across the world, as you see, as the participants are from across the value chain of healthcare. And this, I think, is the biggest legacy that you leave with the leaders, of building those networks to work together to transform health. Thank you, and I open this to any questions you may have. Sneha, you would like to share your experiences in the course and what made you come into this course, what you have learned, how you want to contribute back to this domain, and have your views changed after doing this course than what you thought, that as from a distance, your journey so far, and what do you think your journey in the future will be after doing this course?
Sure, Dr. Rajendra. I would, in fact, thank you and everyone who have been pivotal for me to be here and given me this platform to talk about it. I think I'm here. I will share my experience with mentioning about two important whys. The first why is why digital health, and second why is why this course on digital health. I entered into digital mental health in the year 2019 only to realize the tremendous capacity of providing consultations that I have. Earlier in a OPD setup where I would minimum give 2 consultations, and then if the third one came, I would be absolutely exhausted at the end of the day, because that was a long tedious process which followed up, administering psychological tests, history taking, scoring. But when I joined in the year 2019 health tech platform, history was taken by the AI, assessment was done by the AI, scoring was done by the AI, prescription was generated by the AI. All that I had to do is provide consultations, and my capacity increased from minimum 7 to 8 consultations in a day to 11, especially during the pandemic. Yet I was not exhausted. There was also another interesting observation that I had was people, especially the current generation, like we are going to serve the current generation as healthcare providers, wanted everything instantly on their mobile phones, just like Swiggy and Zomato. They wanted their healthcare professionals to be there, available on their phones. I saw people from remote villages, especially from remote villages in Orissa, in the Northeast, coming up to us for consultations. Especially one particular example where this particular client moved from Delhi to his remote village just to support his parents during the pandemic. When I was taking the consultation, he had to abruptly disconnect the consultation because the villagers were chasing him with brooms and stick, because they felt that he has come from Delhi and he has got the COVID to the village. So that established the importance of digital health and spreading awareness and education. To a recent incident, I would also like to state where I was appearing for an interview, and the HR recruiter, quite a gentleman, quite educated, asked me this question: "What do you mean by digital mental health? Do you mean it's work from home?" And that day, my conviction in this cause, digital health, was even strengthened. It's not about education, but it's about the lack of awareness. Now, let me take you to the next important why this course in digital health. As a common practitioner dealing with common people's problem and common people, I had uncommon insights and revelations which actually disturbed me in terms of many questions that came to my mind. And being a problem solver by attitude, I was only having problems but not finding solutions. This course was my gateway. It connected me to the policymakers. It connected me to the governing bodies who are forming the healthcare policies. And it is now I am a doer rather than thinker and thinking about a problem. I can take these common man's problems to them and do something about it. This course gave me the opportunity to be mentored by the giants and the pioneers in the field. And you will be surprised to know that digital health is not something that has come after the pandemic. These people, the pioneers that Dr. Gupta just spoke about, have been working since 1940s, and they have been waiting for the pandemic only to get the due share credibility and the authenticity of their work. This humbled me to, made me realize that I'm just a drop in the ocean. So huge work has gone behind this. And I think, I would like to invite you to think of this analogy as, just the perception that, humans as the parents and technology as the child. Like every child needs a parent to guide and grow up to a citizen who can be responsible, help others, help neighbors. We need to invite more and more humans into technology so that they can bring in their wisdom, their compassion, their empathy to raise this child technology so that it serves the people, serves the neighbors, and it's a sustainable, scalable, impactful technology that we build together. I think that's all I have to say. I invite you into the world of digital health. Thank you so much for hearing me out.
Dr. Shalini, you have been one of those very rare people in the field at a very senior level, and I still remember my discussions with you early on. And you said, I know this is the future, but this is also the present, and I don't want to be left behind. I want to be the first one to start it. Now, as a doctor, this is a rare quality to have, though it should be the basis, fundamental quality, because the medicine is such an evolving science. New things come, you look at evidence, you change the prescription. So how has been your prescription for life getting into this course? And did this prescription make a difference to you, will make a difference to people around you, will make a difference to the organizations that you serve? What has been your journey like?
Thank you, Dr. Gupta, for allowing me some voice. Nobody listens to me. That's the first thing I would like to say. Okay, so I am working in a government hospital. And in India, a government hospital, which is not in a metro city, means that there will be patients coming to you from all, not really all over, but from all around. Like for us, the drainage area is Punjab, Rajasthan, even UP, the borders of UP. And you can't even imagine the number of patients who come to our hospital. It's like a railway platform early in the morning. AIMS is as bad, but they are providing a little more specialized services. And people look to us, patients look to us for their daily needs. That's because we all know the healthcare structure. It's really fragmented in our country. And it's like, I've been working for the past 20 years in my hospital, and every day I'm working and there is no relief, not for me, not for the patients. And nobody's happy. Patients are complaining. We are complaining. So, it's very obvious that there's a gap. There's a gap where, patients are not getting what they expect, and we are not able to provide what we should be providing. And this is where digital health comes into play. We can reach the masses of India only by digital health. That's my, that is a statement that I think the government should just, frame it and put it on their walls, that without digital health, you cannot reach the masses in this country. So this is, to tell you the truth, I was looking for something where a means for reaching the masses. I've reached that stage in life where I would like to help in, creating something, or, making the policymakers aware of the grassroots problems. I would like to creatively solve these problems. So I was just looking for something by which I can reach these masses. And I knew about digital health, but then, it just came up on the LinkedIn platform for me, a course in digital health. Oh my God, it was like a prayer answered. And I would have been the first one putting in my application. And I was not even sure, because I'm so senior, that I was not even sure that, you all will accept me. I was like, in India, it's like, after you reach a certain stage, you are not supposed to be learning. You are out of that age gap of learning. But I just filled it up, like, let's see whether they'll accept me or not. And that is the day. And today, 6 months later, I'm just thanking my stars and the heavens above for this opportunity. And this opportunity to learn. And I can only say that what I'm learning here, I would like to put it in practice. And I would, if anybody is interested in using my expertise, the experience that I've gained over all these years, and combined with that, the expertise of digital health to solve healthcare problems, oh my God, I'll be, probably very thankful, and I'll be treating them like gods. So it's like, this was a voice in my heart that we are not doing, there's something that we are not doing right in this country. And this course and digital health makes sense to me. This is the way to go forward. So I don't know how else to put it, put my thoughts into words, but I think this is all I would like to say.
Thank you, Shalini, so much. In fact, I keep saying, and I was morning talking to the man behind Da Vinci robot as the architect, and I was telling him that, see, it is not technology that changes anything. It is the people behind it. It are people like you behind technology. As I think Snigdha said in the previous, views, that technology existed for decades, but people started using now. So I think this course does one thing, is connects both. And these are the pioneering souls like you who say, if the medicine is changing now, let me change. So in fact, the one with the highest experience is Flory Brazil, 41 years experience. But these are the people, decided that, oh my God, what an amazing time we live in. You just look at your experience of 30 years and the opportunity of technology, which you learned immediately. So who is a better resource person for healthcare than you? Just think about it. When people ask that I have so much experience, why should I do a course, or what does the value come to me? So those who have seen all the seasons under the sun, and now they know technology as well, can you get a better professional than that? They can actually historically look at all the challenges. They can look at the future technologies and actually help you find solutions that no one can. That is what an experience plus this course puts on a profile. I think not only industry, but the way governments across states are looking, it would be like incredibly helpful. In fact, one senior person from NHS told me, Rajan, I would love to hire people who do this course. I was in for a shock, because of course our country needs more such people, but this is a global course. I will not stop. I don't encourage anyone, to go and contribute to the world. It's a global course, but I see a phenomenal opportunity. I was seeing one of the questions that I have 40 years of experience. So more the past experience of conventional healthcare, and this course that gives you a sense of what's happening now and what's the future opportunity. You can't imagine how indispensable you can become for healthcare. It's just about the openness of mind, Shalini, that people like you, like Snigdha have. Snigdha is working in a senior role. There are people who are at country level positions in this course. Person who is director of the Healthcare Providers Association of India. When I met him, he was CEO of Rajiv Gandhi Cancer Institute. So people like you all, give me hope that healthcare will transform. Our perennial problems will transform, because you have understood that technology is a fantastic platform. We are living in an age where you can have your own multiplier effect by using technology. So I think to me, it makes a lot of sense. When I did a course in Harvard 2 decades back, I saw CEOs of Fortune companies with me in that course. First time as an Indian, I could see that we are blocked. I was CEO at that time. I thought I'd taken a very disruptive approach of going to Harvard, doing a course in retailing, supply chain. But then I was shocked. In US, it's very normal. At every age you go back to school, first thing is it's act as a leveler. You're working across the age sector strata. And then you're learning something new that your current job doesn't teach you. In our current job, it is so demanding that any amount of time falls short. But this course, when you meet people like R.S. Sharma, Dr. Jay Sander, I'm sure Sanjay Sood, Roman, you will find that, hey, this is the guy whom I read about. I used his robot or this technology. He's a man behind, oh my goodness, let me ask this. And then, it's a hair-raising experience. The biggest thing that probably we do is knowledge is one side, exposure, and then the experience of talking to those people, the brains who could foresee how things would come. Like Dr. Jay Sanders, a good 3 decades back, set up American Telemedicine Association. He had the vision that, we needed a body. I mean, these are the people who make you think, who challenge you. I can assure you that all of you, while as a participant of this course with your decades of experience, when you start applying your knowledge, your experience, and your passion, because you see problems in healthcare you want to solve, that's why you are into this, you will find better solutions, a better definition of digital health itself. And I would never change my thinking of this course, that the people in this course will be the people who will redefine this field. And that is what is the expectation. I keep telling, I've told you all many times, those who are current participants of this course, that my expectations from you are much bigger than you have with me. I will only tell you what is here, what is happening, but you will actually make that happen. You will convert that into a reality. So for us, this is leadership development. I mean, it's a real leadership immersive development, that we want to do. And we're really privileged to have people like you, Snigdha. I think it's real, we're really jubilant. We're very happy, which actually puts, when you give us 97, 100%, ratings of what it achieved, I tell my team, I'm worried. They have put so much trust, so much happiness on us. We need to keep that going. We need to increase it. And that is what, motivates us to make sure that the next one is better than the last one. And the last one always was already the best. Now that's my challenge. So we have to make sure that, by the time you end this in February, you would have probably met those people who change it and would have known their thought process, their pain points. Not that they didn't have pain points, how they change. That is what a course should deliver. A course should not be theoretical. A course should be making you read the minds of those inventors, minds of those leaders, how they pioneered. And that is what you get as an opportunity when you interact with those folks. That is what it is.
Dr. Gupta, you should also tell people that I scored 100% in one of the quizzes. So if I can score 100%,
yes,
then, it's a doable course for everybody.
That's true. That's true. And I think the very fact that, that when you're part of a large government institution, which has an OPT, which is no less than
10,000 per day.
Yeah, it is unimaginable. And still, there has to be a pull in the course matching your passion that makes you spend that time and still score very high. That means the connect and the wavelength is same. You believe in what you are wanting to do, and you actually connect, saying, I'm getting what I thought I should get. So it is a pull from both the side. So yes, of course, anyone, when I do it, I would love to see getting 100, even 80%, but I see that most of the places you have been above that only. I think that's the beauty of this course, is that people are understanding, and we are also making it appear in understandable jargon or language. Medical science technology has its own lingo, but we are making sure that it is in a way, form and format where you see things, where you learn from them. And it is understandable. That's why we have those live interactions too, where you can ask even the basic questions. And the best part, that a lot of quality discussions happen in the WhatsApp group too. So there is never a stop for people who want to learn in this. So yes, it's a good. So I would come to Dr. Jigyasu. He's trained in the US, is a part of IIM, has been involved in the course from the very beginning. And his journey, his learnings, I think all of us are learnings too, I would say. It's not that we didn't. We, in fact, probably are among the very few courses in the world we interact with every single participant of this course one-on-one. I think me, my colleagues at IIM, we do that. We have our own share of learning. So Dr. Jigyasu, want to hear from you as well.
Good morning. Thank you, Dr. Gupta. See, I just, because Dr. Gupta is from health field and Dr. Salini is they are from health field, so they can obviously talk about health better than me. I am from management background, and what I can tell is the experience which I had with this course. So during the conceptualization stage, I remember Professor Gupta was asking marriage, why do we need this thing and all those things. What we did is we have aims in Raipur. So we spoke to a lot of doctors, and fortunately the health secretary of Chhattisgarh government, he was very helpful. What he did is he gave us contact to all the doctors in Chhattisgarh state. And fortunately, around 40 or 50 of them, they visited us in IIM Raipur. So they had a training program at IIM Raipur for 3 days. And during that time, I spoke to them and I wanted to know, why do you think this particular course, or what is the thing which you need from us? Because health is obviously independent of what we teach here. So they said, sir, we are really good, we are expert, we are doctors, we know everything about health. But the problem is we are not aware about the updated technology. And the second thing is we are not very well versed in the management. And because these doctors were obviously were doctors in government hospitals, few of them they were running their own clinics, their hospitals. They were saying that we are facing a lot of problem in managing the operations, managing the supply chain, those who had the hospitals. Then they were not able to read the financial statements, the balance sheets, profit and loss account. And I think one of the major problems they were facing was how to motivate employees, right? In the government hospitals also, you have to obviously get the work done from the employees. So then we understood that the big part of this course is the management aspect, right? Because you may be knowing health, you may be really good at all those things, but as Dr. Gupta said, if you are not well versed, if you are not aware about the management things, then you are missing a big link. So that is where we set together and we incorporated the management aspect in this course. And here we are not going into detail all those things, but we are making sure that if you are in a hospital, if you are a doctor, if you are a clinician, if you are a pharmaceutical running pharmaceutical store, or if you are a pharmacist, or if you are running your own hospital, you are going to learn management techniques which are going to help you in achieving your dreams or advance your career and all those things. So this is one aspect. The other aspect is we made sure that you have contact program, the participants have contact programs at time reading, and we will make sure that you learn best at the contact program. And obviously you will have interaction with among the participants and with the faculty members. So this is what we thought that we should have from the management aspect. And one of the important aspect of this is technology management, which I said that doctors and clinicians they were telling that we are not much aware about how to manage technology. So technology management is a big thing, really big thing, because see, a shopkeeper, as Sigda said, that for decades we have all these things. So if you go back 100 years ago, there was a shopkeeper and he was managing the store, right? But if you do not know the technique which optimizes everything, then you will manage the thing, but you will not be able to optimize the management, right? So digital health course which we are running here, obviously, if you do not know the things which require to manage all these things, then you will be missing something. So this course is an excellent amalgamation of digital health, technology management, and the management, right? So this is what I can tell you from my experience. This is what we heard from the people who are in the health sector and who are running hospitals, who are running government hospitals, and this is what their feedback was, and we incorporated in the course curriculum of first batch. We will go back. We will go back to them again. We will ask them, do you think that anything should be added course again? And we will receive the feedback and we'll again sit back and see if we can incorporate anything. Thank you for the opportunity, Dr. Gupta, and I really hope that people will get benefited from this course. Thank you.
Thanks, Professor Jagya. So, Dr. Sandeep, we had walks across on the pathways in Raipur, working, discussing.
Right.
Looking back at that time, I think it's been a good now 10 months or so, more than that probably, when we first met, started working on this course.
Absolutely.
And now that you talk to our participants, when you look at the journey, what do you think has been your views on this course and what we are doing? And what's your message for those who are potential students considering this course?
So absolutely, I was thinking the same. So I was actually going through some of the questions in the chat, and they were actually asking, what is the benefit that I'll get, having the certificates and all that. So which kind of takes me back to the kind time when we were discussing and designing, this course, and we had the IAM team had discussion with DHA. So I wanted to tell all the participants that, the certificate or the certification is actually the basic minimum that you can expect. We have DHA Professor Rajendra was actually working on in digital health for a long period of time. And from the management part, we have IM Raipur. We are also, there. So, I mean, when we design this course, certification or certificate is just one thing. That is only a very small part of it. What we are trying to create is actually more global leaders. So when you look at digital health, it's actually evolving and and evolving at a higher speed. And the kind of canvas you have is much, much broader. And there are two things I want to focus. So if you look at this course, which kind of differentiate this course from other is that there are low many courses in the market. One is the network that you get. You have people with all walks of your, people from industry joining, people, Dr. Shalini is here, who is in the government sector for, over a long period of time. There are people with hospitals. The kind of cohort that you're getting is absolutely diverse and very big. Second is the kind of exposure of who is actually teaching you, be it on the healthcare vertical. All are not just practitioners, they're all leaders. And if you look at management, IM Raipur has been consistently improving the ranking, and there are a lot of our colleagues who is actually the faculty of this program are well versed in research, and research output is very high. So what we are expecting from the participants is go beyond a certification, and we are creating leaders for tomorrow. So when you are a leader, your canvas is much, much bigger. So we are actually looking at a larger canvas where you can actually do a lot. By connecting with these kind of cohort you have, you are just not, getting a certificate. Rather, you are actually a whole lot of opportunities open to you. You can actually start something of your own. You can actually tie it with, some of your batchmates and think something really big, because digital health is that's a sweet spot. It's all about the leaders to kind of put and expand the horizon. So I want to kind of highlight that to all the participants, potential participants, and the current students. Thank you, Dr. Rajendra.
Thank you, Professor Sandeep. I really like the way you articulate it. It's not about a certificate. And I think those who have been involved with me, I still remember I had a colleague, and I would name him Dr. HP-TM. He was the longest serving principal of the Bombay College of Pharmacy, a very respected person, and I had a chance early in my career to work with him. What touched me was he told me, Rajan, my teacher was Sir Linus Pauling, Nobel laureate. I couldn't even think that someone could have been taught by Linus Pauling, whom we had studied in chemistry and would only rear him in books, but someone having been taught by a Nobel laureate directly like Linus Pauling. So it always stuck to me, like what would have been it to be taught by him. So I thought if any time I start a course, I would have the Linus Paulings of their field to be teaching, and that is what we have successfully tried to get you here. So when people will tell you, okay, you did the course, and I'll give you an example also. While you were doing this course very early on, 3 years back, an institution in Bangalore started a digital health course. I asked Mavish to enroll in that. I said, go and look at it. First day she called me and said, sir, their numbers are also wrong. They don't even know what they're talking about AI. The name they said is wrong. This is not, because she was working with me on the course. So I think very rightly, Dr. Sandeep and Dr. Jigyasu, a lot of people will start the course, and that is something that we are waiting for. So far, no one has. We have been talking to, government agency has been talking to us. They have been trying to do a course, because this is a complicated field. It is not easy to comprehend and understand, even despite working at almost every committee in the world. I mean, whether it is the Internet Governance Forum, WHO, World Economic Forum, or Commonwealth, you still feel that you really need to put your life into it to understand it. So I ended up writing a book, which is now a course book on digital health in Germany and other countries. But then developing was a hell lot of effort. It's very difficult and a different thing to write a book, talk about it in a public forum with 10,000 people, and then to do a course. Because this course, I am accountable to you. I am accountable to make sure that you understand digital health from that ecosystem perspective. So yes, it is not about certification. Tomorrow when someone says, okay, you heard about digital health, so software as a medical device, who taught you? Because I will tell you that we get more applications to be a faculty in our course than student, because everyone wants to teach a course on digital health. But we are very careful not to. So in fact, if people are listening, I would tell them, don't reach out to us for faculty. We would choose our faculty. We know who are the leaders we are creating for teaching digital health. Because today it is very hard to find. When it comes to software as a medical, the man who coined the term software as a medical device would be teaching software as a medical device. So we want to make sure when you go out and say, who taught you software as a medical device? No, it was not any medical person who just read a book and taught you. It's the man who created software as a medical device. So who taught you robotics? The person who created Da Vinci. Who taught you fire standard? The one who created fire standard. So for us, it was that experience of Linus Pauling teaching my colleague to bring that into the course. And that's the authority which they teach, because they are the ones driving. And I believe that those who are in the course will be the authorities in the future, because I believe they will create many more things. The intersection of health, technology, and management is disruptive. And this is what this course, I can bet you that all those who are a part of this course now will be people whom people will look up to here, whom people will look up to get answers for the challenges they face. I think almost everyone in this course can actually become a digital health consultant who are doing this course, because they understand this domain better than anyone else.
Absolutely.
That's the endeavor. I mean, when you're doing those 8 projects, you will understand, because all of us will be working, cross-sectional to understand what one is doing. Just understand the universe of digital health that you would understand from these 8 carefully chosen projects. So 8 projects. So, and then, when you get into the IM immersive workshop, you will meet all of your cohort one-on-one, but you will have much more immersive, innovative stuff. And then you will have also people who have deployed digital health skills. So one of the things has been that we wanted to make sure that we save your time of working somewhere and still not losing out this opportunity. That was one of the biggest fundamentals where we disrupted. I'm thankful to our partners, IM, who also agreed that digital health course should be taught digitally. Really science. I mean, like if you're talking about digital health, you should teach digitally. But at the same time, from the people who have done digital health, not theoretical professors. So I think it was an enormous challenge. And the reason we get 2 of our participants and fairly senior, one from the industry, one from the government and a clinician, is to give you a sense that, and we cannot tutor, we will never do that. Ethically, I personally would not my colleagues, none of us at IIM or here, is let people speak freely about what they feel about the course. We just told them we are doing this webinar for people who want considering this course. Would you want to be here? And we never told them that you have to speak. Speak what you believe you learned there. I mean, I think we are trying our best to be retaining our being the best course in digital health. And for that, I think we are very lucky, both on the participant side, on the team side, to be doing our best. And also those pioneers who believe in sharing their knowledge as our faculty. So I think that's one. So let us take the questions that have come, though we may have answered some in our discussion. So I'll go, start from the first. As a doctor who has 40 plus experience in this field, tough to change course of my way of functioning. I want to learn about it, but not sure if this is the right time. So actually, I would pass this on to Dr. Shalini. What would you advise here, Dr. Shalini?
Doctor, I don't know the doctor's name, but Dr. Saab, it's like, there was no need for me to do it. It was just this thought of what I want to do in future. And I didn't even think about whether I will be able to do it. I was just happy to get material to read up and understand digital health. I was not even sure that I'll be good enough to get a certificate. I just wanted to do it, and I have got material. I read it, and then I attempted the quiz the first time. I did well, and that motivated me to study further. And again, attempt the quiz. Again, I did well. So I'm just continuing. So it's, Dr. Saab, as I said, when I applied for this course, I was not sure, because we are of the mindset that after a certain age, we don't read, we don't study. But that's not so, it depends upon what you really want. And beyond this, I will not say anything, because that will be like forcing you to do something that you probably don't want. But you can do it. Trust me, you can do it.
Thank you, Dr. Shalini. And I think given the experience I've had with those, I think at least 15% of our course participants are above 3 decades of experience in this, including clinical practice. And I think the best part is that those who are still young at heart and they believe there is so much to change, age is always chronological. I mean, it's just a number. I mean, I will give you the other example, the very practical one. Look at the people who have disrupted, all those of you who tried Kentucky Fried Chicken. Colonel Sanders started at 64. All the biggest businessmen, I think something my friend told me, his father ran the largest pharma company. He said, you know what, my dad was never successful in terms of getting great business till 65. After that, it is. So in fact, the best of the time to bloom is when you have experience by your side and technology in hand. And there is no age ripe or no age late or no age too early. Today, people at the age of 16 are creating disruptive companies. People at the age of 60 are creating. So I think we remain young as long as we learn. We grow old as soon as we start assuming we don't have anything to learn. So I think the agility lies in leaving age behind. It's just forgetting what the age is. It's just remembering that there is so much to change. And you know what I'm excited about today, in the times we live in, everything is going to change in 3 years. What has changed is not changing in 300 years. Every single thing. I mean, look at 2019. What came about as the quantum computing. No one was prepared. A fastest computer could take 10,000 years to do that calculation, which would happen in a matter of 3 minutes, less than 3 minutes. 2019 for me was like a new Jesus Christ. It was like a new fire that was invented. That was not enough. October 2022, ChatGPT, generative AI. Everything is changed. Big companies are scrambling to figure out, do we survive or not? Someone going to put $10 billion to pick a stake in that. And we still believe that this is not enough. So in 3 years, these two incidents that came to our knowledge have just told us what changes are lying ahead. And I think day for yesterday, when we were having conversation with this founder of humans.ai, one question was asked by a doctor that, will we become irrelevant? He said, not at all, as long as you use technology. So I think the message, and these are the founders who have thought disruptive. Today, the prime ministers and presidents want to meet them. And before he came to talk to our participants, he had met 2 prime ministers just before that. So these are the people whom the governments are looking at to saying, and these are pretty young people. I mean, just imagine, when we talk about age, they could think what people like Shalini could think, what people like others could think. So it's not about age. I mean, you need to be always fertile in your thinking that let me learn technology and let me try something new. I will not be surprised if she comes and does something very disruptive in the way you look at 10,000 OPDs, if you look at patients' problem and solve them. So I think it's about the mindset. It's not about age. So it's not about certification. It's about competence also, which I think the course is very focused on. Certificate, because yes, when you study something for a year, you need a certificate. But it's the competence that you build. I think we are very focused on the competence. And that's why there's 2 institutions, and age to me appears to be just like a misnomer. Forget it. I would say age, you forget it. Think about the opportunity that lies before each one of us. So that's what I would say. The next question is, how is the course different from other courses? From digital health so far, I have had Mavis try one and she had a feedback and I loved it. We'd like more and more courses to come. We should not be the only ones providing. We will always remain different in terms of getting you the best, something that you can use in your practical knowledge. And we shouldn't leave anything to chance. And the best part of this course personally is that each one of us who work on this, whether from the IM side or the Digital Health Academy, we are into it at every level, at every, I think, work with every stakeholder across the world. So it keeps us well informed, it keeps us well connected, and we filter it down, funnel it down to every participant in this course. So I think on the application side, on the leadership side, on the network side, we'll beat any course in the world. I mean, I think one of our advisory board member did a course from Harvard at $1,600 for few days and came back and told us, Rajan, it was trash. And we are saying on record here, because yes, there are big names, but they have still not been able to figure out what to do. One of our course participants traveled recently to US. On a flight, she met someone which is a Ivy League school, and that person told us, she sent me a mail that they were trying to figure out digital health course. They have still not been able to figure out. So yes, we will still be proud if we continue the same level of commitment, the momentum, the knowledge, and as our course detailed document says that topics will get added or get deleted based on the developments in the field. That's the agility we have in the course. That's the kind of things we do. If we find that, okay, this is going to be something that is something to learn, we will not say that since it was not in the course, you will not get it. Every member of my team is always considering and evaluating all the developments that will impact healthcare. And our job is to make sure you have it in you while you're doing this course. So I think that is something that sets us apart from any other course that you would think of doing. So, and of course, as health technology and management, we are the only course, but to us, it goes beyond those three words. It's about creating competence about digital health. Future leaders, as we said, that's our vision. So that's why we are different. For those who have attended the course, what are the practical benefits they are able to get? I think that Dr. Shalini and Snigdha can say. I would not be able to comment. So Dr. Shalini, you first and then Snigdha.
I'm still in a government service where it's a completely bureaucratic organization, but I have ideas because of this course, which I would like to implement in future. And I keep suggesting it to my authorities that we can, change things in a certain manner. So right now, that is all I can do, but I'm hopeful that I'll be able to do much more in the future. I think Snigdha is doing a very fine job of digital health, so we'll hear from her.
I think I was fortunate to get into digital mental health way prior to the pandemic. And I think this course gives me, and I think I'm a little more privileged as a mental health professional because I as a mental health professional, I don't administer medicines. We provide alternative medicines, right? That is therapy. And therapy goes beyond boundaries, and this helps me devise the current digital, expand and build upon the, mental health specialty where I'm working in my current organization at MFine. And when it comes to what practical, I mean, what more practical exposure you can ask for when you're being taught in a particular subject by the pioneers, the first people who have done the groundbreaking research and study on that in that area. So not only the practical exposure that you get digitally, you also get to meet them, right? Like the recent Global Digital Health Summit that we had, right? We got to meet them, and trust me, it used to appear as a big deal, like will they even talk to you, or where am I, where they are? But that bridge has been gapped due to this course. I mean, if not because of this course for the Global Digital Summit, I would have felt like I am a stranger, but that felt like home because people are working and we all have come with a common intention, and that is digital health. Everyone wants to listen to you, no matter how big and small. As long as you are, passionate about what you're doing, you will always attract someone who would want to work with you. So this is the biggest practical exposure that you get. People know you, they know you're working in this field, and when the right time opportunity comes, you're the one who comes to their mind for the first time.
Not
right?
just that, the networking, Snigdha, the
Absolutely.
networking, and you get to know what is happening in this field. It's like, the summit, the global summit, and this course has literally, it's literally opening my, it's like I'm taking the first breath after such a long time. So, the possibilities and how you can change your own life and that of your patients, that is a very important practical aspect of this course.
And I would add to this, Dr. Shalini, that when as what we work in this field, when we got the presidents of FOXY, the Indian Diabetes Academy, and the Indian Cardiology Society, these people told us, I mean, these are the presidents of the largest societies, that represent probably 100,000 plus doctors, that we always were stuck in our OTs and OPDs. We never came out of that to look at the world is changing. And for them, now they are chasing hey, look, please take our doctors and get them to use technology. So I think all of us have to also see to believe it, and the course makes that happen. Through the work that we do with people across the world, we make that happen. The first thing that all of us have been, before we got into a profession, was students. We read books, we had question and answer, gave exams. Then we moved to a practical life. Then we hit the road. Then we realized the world is different than schools and colleges. So same happens in this course, that when you move from your routine paradigms to this kind of exposures, you hit the road and say, hey, the world is much more different than I thought. It's much more exciting. And the excitement leads you to do more things, whether it is handling your patients, whether it is handling your job, whether it is looking at the newer opportunities for you. So we have had people, coming to us saying, we will start an organization, a company, in this field. So I think the possibilities are immense from the clinical, academic, and even entrepreneurial opportunities. So depends on where your internal calling is, where your inner calling is. So I think the canvas is large, the exposure is matchless. As I can promise you this on record, that there should be no course available that can give you an exposure that we give from across faculties, across the world, and across the continuum of care. That is something that I will always ensure, that you get all the exposure you need in digital health to know it, to be with people who do it, who will still do it, and to create people in the future through this course who will end up doing what you're going to watch and meet today. So I think on that side, we will be always very different, and that would be the value we bring. The question is, will this course, the other is, who can join the course? Can the freshers join this course? I'll put this to Mavish.
Thank you, sir. So for freshers, it is like if you are of 25 years, you can apply for postgraduate certificate. You need to have minimum of 2 years of experience. But being just a fresher, if you are having a specialized course that you have done, you can apply for it. And if you don't have experience, the minimum age limit is 25.
Thank you, Mavish. Because last year we had a lot of applications, and there are rules that we have to respect and follow as guidelines of IIM. We totally adhere to that. So these are the qualification criteria, and unfortunately, we are bound by that, and we respect that. And this is what it is. As a fresher, you can, as long as you have a professional degree, like nursing, doctor, physiotherapist, pharmacist, but 25 years of age or 2 years of experience is great if you have. Then you do qualify. Of course, the mandatory interview is important. You have to pass that with the IMT. They have to sense and discuss. And then it is, will the course help me in understanding the basics of digital health? Yes. This is, I think, today, if you ask Snigdha and Shalini, they will be the best person to tell you. Have they understood the basics of digital health? Shalini, you and Snigdha.
Yes, very much. It's like digital health was just DIGITAL for me. Now it is, digital therapeutics, the building blocks, the other building blocks, the, how telemedicine works, how it can be used in primary care health. So it's a lot more than what it was for me earlier. So the answer is a definite yes.
Snigdha?
Absolutely. I mean, a lot of my concepts have been clarified, especially a person who's very bad at abbreviations and to get confused between them, like what is electronic medical record, what is electronic personal health record, what is electronic health record. All these differences were very confusing for me. but this course has given the clarity as to these normal, simple things that we ask, and to the starting from the most the thing that may appear to the most silliest to the most conceptualized terminologies, the systems. So who are the systems who are a part of the digital health ecosystem, right? The building blocks, as I said, the terminologies, the organizations that are working, and how are they interdependent. So all of these concepts have, so far we are still into the course. We have not completed it. We are 6 months into the course. And I think building block has already been set strong. And we are only looking forward now to working for the projects that Dr. Gupta just, mentioned.
Thank you. So another question is why it is certified digital health professional. So I'll tell you first, what is certified digital health professional? As I said, that when we looked at the course, for us, it's not a business. We are not into the business of teaching. We are in the business of creating future leaders. That is what I figured out very early on when I looked at the problems. My other profile is that I have served the governments. I've served on the global committees. When I used to look and hear out people, I used to see the pharma CEO talking about pharma. I used to see the hospital CEO talking about the hospital. I used to see the insurance guy talking about the insurance, but no one talked about the healthcare as a paradigm. So I could see the siloed approach. So one of the things we figured out, at least I could, or I could be wrong, is that there's a lack of leadership that understand the domain in totality. And I saw that this digital health domain, which is coming, is going to be covering everything under the sun in here. So first thought was, how can we create leaders in this? How can we have leaders who would understand this in totality? So that's where it came. What would it make? What would the vision be if someone wanted to do this? So one was that, okay, let's get them understand digital health from an ecosystem perspective. What is that digital health ecosystem? What are the building blocks? Where it is headed? So once you know the basics, like when you study organic chemistry, if you understand the basics clear, you can address it. Same is in maths. Same as in physics. If you understand the laws of physics, you can actually understand it well. Science is about understanding the frameworks, the laws, and the thinking behind. So for me, digital health is a science. So what we did was saying, let's create future leaders. The intent is to create leaders, and for that we need to make sure that for what will make to. It was very easy to coin the term certified digital health professional. The difficult part was, how do we make it happen? First is to create the content. Second, the content has to be in a structured form where you could connect the dots and think about the future. And third is, who are the people who will make you understand the content from a position of authority? So for us, these three things, the structure, the content, and the authorities that make you a leader. So you actually ended up becoming digital health professional. So by the time these people, these leaders who are our participants, they complete 1 year, they would be certified digital health professional. And this is the first time this was created in the world, and this will remain our proprietary thing of creating certified digital health professionals. People can copy the name if they want to, but not the way we do it. And I think everyone who does the course will have the opportunity to suffix CDHP with their name, that they are certified digital health professional, because I'm 100% sure there is nothing in digital health they would not be able to answer till the time it is there. So that's that's what we have chosen people in our course. Out of 2,500 people who applied, 128 selected in terms of shortlisted, and finally 50 approved, 47 enrolled. So we are very clear that we only understand the passion. I've been personally there for every single interview. I make sure, because there has to be that inner feeling from the people about it. If we don't grasp, we had good people writing to us, interviewing, being interviewed, but we didn't find that spark that would create information at IM and Digital Health Academy is creating that leadership. So for sure, certified digital health professional is something that for us comes very natural progression for doing this course. And that I think anyone who is doing this course would remain a certified digital health professional, because they would understand this domain professionally, and we would certify they understand it through this course. That's why they test. You cannot move to the next lecture if you're not done 50%. And trust me, all the questions are very carefully designed. And the designing of the questions are also done in a manner where the element of digital and the element of that inflection point is reflected. We don't pick up routine questions. So I'm personally involved in that, making sure that, those who do 50%, they actually understand the fundamentals of being certified. So for me, it is not just a word. For me, it is a training for competence. So it is a certified digital health professional in that sense. So today, if anyone asks them, like Shalini, I think in a very natural flow explained how she got to know building blocks. She could actually tell you those 3 words. Anyone would understand the building blocks, the ecosystem. So it starts with that. So by the time people complete 1 year, they would understand digital therapeutics, they would understand the digital population health, they would understand blockchain, they would understand AI, they would understand robotics. So they would understand the entire digital health domain. Anyone can make them sit and ask them the questions. They would be literally certified digital health professionals. That's what we mean with this. So future prospects of the course, as I said, healthcare is going to be digital. It is digital as we speak. Even the governments are recruiting in every state in the digital health mission. If government has a digital health mission where they have issued 46 crore, 460 million ABA IDs, making it 1 billion, starting a health information exchange, trust me, all insurances would move to an exchange where transactions would happen. How many of us in healthcare know it? How many of us in healthcare use an electronic health record? Will we stay for long without it? Possibly not. Anywhere in the world? Possibly not. When evidence starts mounting, how far would you say? And I'll give you another example. Today, go to Instagram. There are advertisements that say, I use this, and coming from a renowned film star, I will not name that I've been able to reverse my diabetes using this solution. Now just imagine if you're an endocrinologist, your patient walks to you and says, sir, I got to see this ad. What do you think about it? If you dismiss it, he will actually go or she will go and enroll in that program. If the diabetes get controlled, you know that who lost out. So I think if you know your technology, what you use, your patient would already be using through you rather than waiting for the ad. He would actually watch that and say, oh no, my doctor already prescribed me 6 months back. I know what they're talking. So I think the prospects of this course is securing your future in one line. Securing your future in terms of professional, because every organization is looking at digitalizing them, moving to automating their organization. Every doctor has to look at how do I handle my new age patient, because you have to use technology. So in one word, the prospect of this course is prospects of your future. So if you have to secure whether you do this course, any other course, I will not even say do this course. You find any other course, just do that. But make sure you know digital health. My message to anyone would be, if you're not in digital health, you're not in health. I mean, I do this course because I believe in it. And I run this, I can only talk for this course, but I would strongly recommend anyone do a course in digital health. You have to do it. We would have limited capacity, but I'm sure there are other courses that will come up, that are going to come up for sure. You should do this course. Do I need to have a background in technology for doing this course? Dr. Shalini, did you have a background in technology? And did you face a handicap?
The only background I have is that of radiology. And if you consider radiology as technology, then that is the technology background I have. And nothing, absolutely nothing at all. I have been a through and through medical person throughout, and I'm still able to do it.
Great. Snigdha, what about you? You're on mute.
I think when I joined this course, I was already into the background of technology, but I'll give a different perspective. Personally, I'm not a person of technology. I mean, if I tell you, I don't know even how to operate on a remote to switch on the TV. And I was a person, I used to hate mobile phones like anything. But then life got me to a place where mobile phone today is my bread and butter. And why I like it? Because I'm driven by the passion of the cause, that it helps us reach out to so many people and offer the help at the right time when needed. This is more than enough for me to put up with my mobile all day round. So I think even if you don't have a background or an interest, but the cause is so empowering at present that and then you don't have an option also. Do you have an option? And like, even if you say that I don't like technology, the truth is you have watched your television some other time. The truth is you have ordered something from Big Basket. The truth is you have ordered something from Amazon or Myntra. So you cannot say that you're not a person of technology, and that would be hypocritic to make a statement like that. So we are all into technology, and there's no escape to that.
And I think it's more about opening your mind. That is the only technology you need. The only technology background you need is an open mind. Rest all, I think the course makes it very simple. That was the approach for everyone. Just keep an open mind. That's the only technology I request my people in this course to have. So I have a question from Nilma Harish. Since all sessions are pre-recorded, can we have online session with faculty to discuss our queries? So I think the difference, so for me, one of the biggest challenge, and that's why probably we do this webinar is, and put before you our participants and our faculty both, is that while we believe that we have done extremely well in trying to offer a course which is asynchronous, but at the same time, we have also got live sessions with leaders to answer your course questions. And these are not theoretical leaders. These are the people who have deployed technology at scale. So you can ask them actual questions on deployment, on development, on digital health. That's the biggest difference in terms of live sessions. More than that, we also host on the sidelines annual digital health summit, where you actually get to meet, as I think Dr. Shalini and Snigdha say, that you actually get to meet world leaders, talk to them, and on the sidelines, we also host a session with our faculty dedicated. And I think as time progresses, we will increase that. So yes, we have multiple opportunities. Then you would have an opportunity to be at IM for 3 days, spending time with colleagues, with people in digital health on projects. So yes, I don't think there is dearth of that, and it just doesn't become a monotonous one in terms of online lectures. It's very engaging, let me tell you. It's really engaging, and I think I'll let Snigdha and Shalini answer that on the engagement. And do they find it really exciting, or do they get bored by online lectures? Shalini, you, and then Snigdha.
To tell you the truth, during the basic course, you just don't have the time. Meaning, you have the time. You have more time than for the other modules. But you are so into trying to understand that you don't miss live interaction. Like I didn't miss live interaction. I wanted to know what is digital health. And then I wanted to interact with people. There was this WhatsApp group, and we could just write our query. We can just write our queries in the WhatsApp group, and either the faculty or the other participants who are very knowledgeable in their own fields, they answer that. So that's a lot of my interaction, feeling for interaction satisfied. Then there is this LinkedIn, like I hope somebody, please look me up on LinkedIn, and I'm forever talking about what I've learned, and then somebody or the other answers that. And then these live lectures, oh my God, half the time I'm sitting starry-eyed looking at all these faculties delivering these lectures. And the best part is that they take the time to answer all of our questions. I don't think I asked even one sensible question, because digital health is very new to me. But for them, every question of mine is important, and I get an answer. And now the faculty and with these webinars and everything, it's increasing day by day. We still have about 6 months left, and there is still a lot more to come. And it doesn't feel as if I'm not interacting with anybody. So let's Snigdha say her.
Absolutely. I think I second Dr. Shalini. It doesn't feel like you're not interacting with anyone. I think the best part about having the course on a digital platform is that you are not under the pressure of, attaining certain targets or deadlines by the end of the day. You are your own master. Of course, when you pick up an online course, you need to have certain, your own sense of discipline and your own sense of timeline, because you are also a working profession. So if I had to speak about my own personal experience, I feel it gives me the privilege to pick up the course, the assignments in my own flow, at my own ease, and because of which I'm not in the pressure to perform, because of which the performance is better. So I think a lot of times when you're under the pressure to perform, you make up mistakes, right? You tend to not learn, and then that I think it's a very healthy interaction and discussion that goes on, and there is no unhealthy competitions, because you're just not getting to see who's doing what and who's not doing what. I think as a professional also, and we are also operating in a very competitive world, this gives you the ease to be with yourself, your system, and whenever you need, the people are there. We do have a WhatsApp group. Wherever we have our concerns, we address it. And Mavish, her team, Dr. Gupta's team they have been very, very helpful to us whenever we have any concerns to, address them. And the live sessions, even if you're not able to attend them live, they are recorded. So let's say if you've missed them for any work or anything, you can always go back and you can see, pause, take screenshots, make your notes. You can always do that. I think this kind of a privilege brings in more and more working professionals who have the expertise or want to develop the expertise. So I don't think you will at all feel left out. The course curriculum is designed in such a way. And also I would like to tell you that we do have our feedback sessions also intermittently. The faculties from IIM, from Digital Health Academy join us. They give us the feedback about our performance, encourage us. So no way are you going to feel left out at all. It's interactive, but in a digital way.
Thanks, Nida and Shalini. I think the intent was that, while we don't intrude into your professional life, don't let you feel that, oh, there is a difficult choice to make. We want to make sure it is as smooth as possible. And this is such a field that you don't have trade-offs. It's a compulsion to learn today, and I think the more enjoyable it is, the more value it brings to you, the more drawn you are towards it. You don't feel tired, when you are doing something when you love, when you enjoy. Our job is to make sure it's really valuable, it's enjoyable, it's inspiring above all, so that challenges you to do more. So we are trying to fill that bucket in that. Dr. Jigyasu has to leave. Thanks, Dr. Jigyasu. We'll also end in a few minutes. I have to leave for airport, but I'll answer a few questions before I leave. So Rahul is asking, would we be exposed to public policy for healthcare and technology? Where are the policies for technology and policies for healthcare separately? So yes, one of the things that we continuously engage with leaders is on this. So while you will have leaders in the course who do this, the other side, the annual summit we host, you actually get policymakers in the room. So you had the Drug Controller General of India, you had senior people from the government in that. And not only we do it here, when you get to lectures coming out from Europe and US and other parts of the world, at times you may have policymakers taking your lecture. And we actually feed, on the other side, we do as one of our think tank on this, one of the SBUs, which is our think tank, the Health Parliament, Digital Health Academy actually gives in inputs to WHO. We have submitted 2 policy papers to WHO. We are now submitting a policy paper to National Health Authority. So the goal is that in future, those who are working right now on 8 projects will be the people, who would end up working with us on the projects and inputs to WHO, to Commonwealth. The whole idea is to use all our networks, the knowledge gained, the thinking that is getting, created, is to feed into those global bodies. I think that is what we should beautifully be able to do within our groups. That's why I think I see more opportunities coming from creating these leadership who will be able to give policy inputs to people. And I think we are all constantly on the discussions with them to how to evolve with time. There is a message from Rituparna Chandrakar as a business development manager in an IT company in Pune, India, and chief digital officer. How is your expectation from digital and leaders like us for this course on digital health? So Rituparna, as I said in the beginning, your expectations can be set right, that you understand digital health, you get the knowledge, you meet people, understand their thinking, learn from them where they probably failed or could have failed, how they sailed through, But my expectation is much bigger if you join this course, is that you have to make sure that the scope and scale is nearing 100%. The vision is that Alma Ata happened 45 years back. We promised health for all by 2000. We have missed that by 23 years. But when we touch 50 years of Alma Ata in 2028, we should at least have digital health for all. So all of you in this course will have to be working towards it. That's the big grand vision we have set, is to ensure digital health for all. And this is what we have to do in everything we are doing to make sure that by 2028, the world at least achieves digital health for all. So I think most of you would get invite from us from the various places. We are like as Digital Health Academy, we are the founding members of the Dynamic Coalition on Digital Health at the United Nations IGF. Next 7 days, my team here would be there. We'll be unveiling our report, our work at the Commonwealth, at the WHO. So the goal would be to use our collective knowledge to create policy and strategy papers for the industry and for multilateral bodies and governments to show them the way forward. That's the whole idea. So yes, I mean, not only giving inputs, but I think leading the thought process for public policy and technology. That's why you have Bakul Patel on our board. He led US FDA for digital health, but he's the man who put digital health where it is today. That's why you have people like Brian. That's why you have people like Anish Chopra, who was the first CTO of United States. When Obama came to power, the first thing he did, appointed Anish Chopra as the Chief Technology Officer of United States. So that's why we have this lady who takes your course on privacy. She was the privacy officer of the Health and Human Services Department. So our goal is to make you work closely and talk to them, those people. So I think we would not leave any stone unturned in terms of intersection of public policy, public transformation on technology-driven care. So I think we would be doing that. I would love to take question, but I'm exceeded by time by 8 minutes, and I think I would get angry looks from my team who are waiting for the lunch, and I for my packing to leave for the airport. But been amazing discussion. Do send us your question. You have your email ID. Look up our Twitter, Facebook, our Instagram, or even our website of Digital Health Academy. I Am Raipur has a complete section on digital health. Go to their website. Happy to answer your questions and look forward to creating more leaders for tomorrow so that we don't have dearth of leadership. If that is in place, healthcare will not have any challenges. Snigdha, thank you so much. Dr. Shalini, thank you so much for your time, despite your busy schedule. Dr. Sandeep,
Thank you.
Dr. Jigyasu, Mavish, Ashima, Priya, Akshita, everyone from the team, thank you so much. Wish you good luck. Let's transform healthcare. Thank you so much.